to A Balancing Act, a podcast devoted to helping families navigate memory loss. I'm Kelly Burtonshaw. When a loved one is diagnosed with memory loss, everyone's lives change. Family members now have to juggle their loved one's increasing need for care while also trying to manage their own lives, families, and careers. It truly becomes a balancing act. I've worked with those affected by memory loss and with their families for more than 20 years. I created this podcast with the goal of helping you and your family face these challenges head on. Together, we'll find the answers because no one should walk this journey alone. Let's get started. Welcome back, everyone. Today, I want to explore with you the relationship between dementia and hallucinations. Now, not every type of dementia comes with hallucinations, but if your loved one has been diagnosed with Lewy body, Alzheimer's, or middle to late stage dementia, hallucinations are an unavoidable symptom. And I know that this can be an overwhelming subject, and I know it's also heart-wrenching to see a loved one in an hallucinatory state. And add to that, not knowing why or when the hallucinations happen can also make you feel like you're dealing with a ticking time bomb. So today, let's walk through what you need to understand and prepare for when your loved one is experiencing hallucinations. I want you to also have a really clear understanding of what a dementia-related hallucination is and what it isn't. And finally, I want to give you some tools you can use right now if hallucinations are a part of your loved ones and your lives. Perception without an object. Now, that is the classic definition of hallucination. But here are the basics. Hallucinations are the results of the changes to the brain caused by a dementia. And all hallucinations have to do with the senses. Because as dementia progresses, the brain's ability to take that information in from the senses is interrupted and garbled. And then, because the processing and the information sharing parts of the brain are also malfunctioning, the brain misinterprets the information it does receive from the senses. That's why during hallucinations, a person can see, hear, smell, taste, and even feel something that isn't there. Let's start with the dementia most likely to come with hallucinations. Lewy body dementia. Persistent and frequent hallucinations begin very early in this process, and they're often the first signs of the disease. And what's really interesting is the type of hallucinations particular to Lewy body dementia. They're complex visual hallucinations. Now, these are very detailed visions of insects and people, inanimate objects, animals, and animated figures, most often children. And it's very common for a person with Lewy body to see bugs crawling all over the walls or children hiding in the corners of their room. Now, when it comes to Alzheimer's disease, hallucinations can begin at any time, but usually they increase over the middle to late stages of the dementia process. And Alzheimer's hallucinations are characterized by seeing or interacting with people, animals, or objects that aren't there. For example, a person with Alzheimer's hallucinations may report seeing a long-deceased friend or loved one sitting next to them on the couch. Or they might describe a non-existent picnic table in their bedroom. Now, the reasons it's important to distinguish the cause of these hallucinations are because there are medications that can help control them, and because we need to rule out causes that are not related to dementia, so you can best know how to respond. Whenever a loved one starts hallucinating, the first thing to do is contact your loved one's physician. They are the ones that can determine if these hallucinations are related to dementia or other medical conditions. Fever, infection, migraine, or pneumonia are temporary culprits. Other conditions that bring physical damage to the brain, such as stroke or traumatic brain injury, can also come with hallucinations. Additionally, hallucinations can be a side effect of certain medications, particularly those used to treat Parkinson's disease. And sometimes what seems like hallucination can be related to the condition of your loved one's sensory organs. Consider if the hallucination your loved one is experiencing is actually related to their deteriorating eyesight or hearing. Or maybe their hearing aids or glasses aren't working for them anymore. And check how they're taking care of themselves. If your loved one is tasting something in their mouth that isn't actually there, maybe it's because they lack dental hygiene. And maybe what they describe as something on their skin is actually dryness or a rash. Now, the best way to determine if these are the case is to ask your loved one to describe what they're experiencing. And look around for the cause, like not wearing their glasses or their hearing aids. Did they maybe leave the TV on in the other room and now they're hearing voices? Or maybe they were seeing little bugs on their sweater because it has a very busy design and they don't have their glasses on. One woman I know, because of her very poor vision, was consistently putting liquid soap on her skin every day instead of lotion or cream. I think you get the picture. So now that you have a better idea of exactly what dementia-related hallucinations are and aren't, let's talk about ways to respond when the real thing happens. If your loved one is experiencing things that are not there, these things actually are there to them. I want to stress that again, to them. It is every much as real to them as you watching them is to you. Now we know these two realities, of course, cannot coexist without some friction or problem. But I tell families I work with, whenever trying to help a loved one with dementia, lead with their reality. So, when your loved one is experiencing hallucinations, first of all, acknowledge what they're experiencing by repeating what they say to you about it. You can try saying something like, "Mom, look at all those children climbing on the furniture. You're worried one of them will fall." Then you can try offering a solution. "You know what? Let's go find their parents. We're going to tell them to stop acting like that." Or you can direct the topic in another direction, such as, "Those children are climbing all over the furniture. Did you ever see us play like that when we were young?" While gently guiding them away from the situation. Reaffirming what they're experiencing, repeating what they're saying about it, and then redirecting them are excellent ways to lower the temperature and change the direction and intensity of your loved one's attention. Things that will not lower the temperature, but in fact will make it worse, would be to tell them that they're wrong, that what they're experiencing isn't real, and they shouldn't be worried or sad or frightened. Again, lead with their reality. It's the only one that is or can be real to them. It is also vital to find out exactly what type of dementia you're dealing with. As I mentioned earlier, certain types and stages of dementia are more likely to produce different types and timelines for hallucinations. Being forewarned is forearmed. And be sure and talk with your doctor the moment you suspect hallucinations. You want to get on board with any medications that will help. I also recommend trying this. Keep track of the hallucinations, because you might find patterns that can provide clues to things that trigger those hallucinations, such as time of day, television programs or movies, different music, loud sounds, certain smells, or even fabrics. But I want you to keep this little tidbit in mind. If the hallucination is pleasant or enjoyable for them, why interrupt it? You and I both know the fewer times you're surprised by these hallucinations, the better. And know, please, when to ask for help. During hallucinations, if a loved one is violent, aggressive, unsafe to themselves or others, do not try to deal with this on your own. And if patterns such as these arise, make sure that your loved one's doctor knows about it, and make sure you have a trusted person familiar with your loved one on standby in case you need help. Now, in cases of immediate risk or harm to themselves or others when they're hallucinating, call 911 and be sure and tell the responders that your loved one has dementia. Hallucinations can be deeply unsettling and frightening for both you and your loved one. The more informed you are of their likelihood, their type, and frequency, the better able you and others will be able to cope with these difficult events. Please check out the resources I've provided in the show notes for more information, and feel free at any time to reach out to me on our Facebook page with comments, experiences, or questions about this or any dementia-related topic. I'd love to hear from you. And when you're dealing with situations as difficult as hallucinations are, keep this in mind. No one is perfect at this. No one. You're doing the best you can. You're doing it from a place of love, and that is enough. I'm Kelly Burtonshaw, and it was my pleasure spending time with you today. Keep in touch.
I'm Peggy Wright, editor and producer of this podcast. If you like this episode, let us know by following A Balancing Act wherever you get your podcasts. Please take a moment to rate and review. We have a new Facebook page, and you can find us on our YouTube channel. Be sure to check us out and leave any comments or questions for Kelly. It's really important that you reach out to us so that we can continue to provide relevant content to help you navigate a loved one's memory loss. Links to all our socials are in today's show notes. We are here to help, and we hope to hear from you soon. Thanks for listening today.